Understanding Monkeypox, a conversation with Dr. Yava. Hi everyone, Dr. Yava here. I'm excited to talk to you today about an important topic that has been making headlines recently. Today let's talk about monkeypox. It's a viral infection that we need to understand. This virus has been around for a while, but it's crucial to stay informed about how it spreads and how we can protect ourselves. Don't worry, we'll break it down in a simple way. My goal is to make sure you leave this conversation with a clear understanding of what monkeypox is and what you can do to stay safe. Monkeypox is a zoonotic disease. This means it originates in animals and can be transmitted to humans. This means it can spread from animals to humans. It's important to know which animals are commonly involved in the transmission. While it's called monkeypox, rodents are more commonly infected. These animals can carry the virus and pass it on to humans through direct contact. The virus can then spread from person to person. This human-to-human transmission is something we need to be particularly cautious about. This happens through close contact with an infected person or animal. Activities like touching, hugging, or sharing personal items can facilitate the spread of the virus. It's important to be informed and take steps to protect ourselves. Simple measures like washing hands frequently, avoiding close contact with infected individuals, and using protective gear can make a big difference. Let's dive in and learn more about monkeypox together. By understanding the virus, its transmission and prevention methods, we can better protect ourselves and our communities. Stay tuned for more detailed information and practical tips. Recognizing the signs. What does monkeypox look like? Monkeypox often starts with flu-like symptoms. You might experience fever, headache, muscle aches, and fatigue. These initial symptoms can last for a few days, then a rash usually appears. This is a key characteristic of monkeypox. The rash often starts on the face and spreads to other body parts. The rash changes over time. It progresses through different stages, from flat spots to raised bumps filled with fluid. These bumps eventually scab over and fall off. Monkeypox transmission. How does it spread? Monkeypox spreads through close contact. This includes direct contact with an infected person's rash, scabs, or body fluids. It can also spread through respiratory droplets. These are released when an infected person coughs or sneezes. Prolonged face-to-face contact increases the risk of transmission. Contact with contaminated materials can also spread the virus. This includes touching clothing, bedding, or objects used by an infected person. Pregnant women can transmit the virus to their fetus. It's crucial to take precautions to prevent the spread during pregnancy. Protecting yourself and others. Practical tips. Protecting yourself from monkeypox involves simple yet effective measures. Let's discuss some practical tips to stay safe. Avoid close contact with infected individuals. If someone has a rash or is suspected of having monkeypox, maintain a safe distance. Practice good hand hygiene. Wash your hands frequently with soap and water for at least 20 seconds, especially after contact with potentially contaminated surfaces. Section 5. Skin-to-skin contact, a closer look. Skin-to-skin contact is a primary mode of monkeypox transmission. Let's delve into specific situations where caution is crucial. Avoid touching the monkeypox rash or scabs. Direct contact with these lesions can spread the virus. Refrain from sharing personal items. This includes towels, bedding, clothing, and utensils. Sharing these items can facilitate virus transmission. Intimate contact, including sexual contact, can spread monkeypox. Use protection and communicate openly with partners about any potential risks. Section 6. Avoiding contact with contaminated materials. Monkeypox virus can linger on surfaces. Let's explore ways to minimize the risk of transmission through contaminated materials. Clean and disinfect surfaces regularly. Use EPA-registered disinfectants effective against monkeypox virus. Pay attention to frequently touched surfaces. Handle potentially contaminated materials with care. Wear disposable gloves when handling laundry, bedding, or objects used by an infected person. Wash potentially contaminated items separately. Use hot water and laundry detergent to effectively clean clothing, bedding, and towels. Section 7. Respiratory precautions. Protecting yourself and others. Respiratory droplets can carry the monkeypox virus. Let's discuss measures to protect ourselves and others from respiratory transmission. Cover your mouth and nose when you cough or sneeze. Use a tissue or the inside of your elbow to prevent the spread of droplets. Wear a well-fitting mask in crowded or poorly ventilated spaces. This helps reduce the risk of inhaling or spreading respiratory droplets. Maintain a safe distance from others, especially if they are coughing or sneezing. Physical distancing remains crucial in preventing respiratory transmission. Section 8. Vaccination, a key tool in the fight against monkeypox. Vaccination is an essential tool in controlling the spread of monkeypox. By immunizing individuals, we can significantly reduce the transmission of the virus within communities. Let's discuss the available vaccines and their role in prevention. The JYNNEOS vaccine, for instance, has been a game-changer in our fight against this disease. The JYNNEOS vaccine is a 2-dose vaccine that can prevent monkeypox or reduce the severity of illness. It works by stimulating the immune system to recognize and combat the virus effectively. It's important to receive both doses for optimal protection. The first dose primes the immune system, while the second dose boosts the immune response, ensuring long-lasting immunity. Vaccination is recommended for individuals at higher risk of exposure. This includes those who are in frequent contact with infected individuals or who work in environments where the virus is present. This includes healthcare workers, laboratory personnel, and close contacts of infected individuals. These groups are prioritized to receive the vaccine to prevent outbreaks and protect public health. Consult with your healthcare provider to determine your eligibility for vaccination and the appropriate vaccination schedule. They can provide personalized advice based on your health status and risk factors. Staying informed and proactive about vaccination can help us all stay safe and healthy. Section 9. Seeking medical advice. When to contact a healthcare professional. Knowing when to reach out to a healthcare professional can make a significant difference in managing your health effectively. Recognizing when to seek medical advice is crucial for timely intervention. It's important to be aware of your symptoms and understand when they require professional attention. Let's discuss situations where you should contact a healthcare professional. This can help you avoid complications and ensure you receive the care you need. If you develop a rash that you suspect might be monkeypox, seek medical attention promptly. Rashes can be a sign of various conditions, and a healthcare professional can provide an accurate diagnosis. Early diagnosis and treatment are essential. Timely medical intervention can prevent the condition from worsening and help you recover more quickly. If you have been in close contact with someone diagnosed with monkeypox, inform your healthcare provider immediately. They need to know about your exposure to assess your risk accurately. They can assess your risk and recommend appropriate measures. This might include monitoring your symptoms, providing preventive treatment, or advising on isolation to prevent further spread. If you experience severe symptoms such as difficulty breathing, severe headache, or confusion, seek immediate medical attention. These symptoms can indicate serious complications that require urgent care. Always err on the side of caution and consult a healthcare professional if you're unsure about your symptoms. Section 10. Staying informed, reliable sources for accurate information. During outbreaks, it's crucial to rely on credible sources for accurate and up-to-date information. Let's identify some trusted resources. Refer to your local health department's website and social media channels. They provide localized guidance and updates on the situation in your area. Consult the Centers for Disease Control and Prevention, or CDC website. They offer comprehensive information on monkeypox, including symptoms, transmission, and prevention. Rely on reputable medical websites and organizations. The World Health Organization, or WHO, provides global updates and guidance on monkeypox. Section 11. Monkeypox prevention, a shared responsibility. Preventing the spread of monkeypox is a collective effort. Let's emphasize the importance of individual and community action. By staying informed, practicing preventive measures, and seeking timely medical advice, we can protect ourselves and others. Let's work together to raise awareness, reduce stigma, and support public health efforts. Remember, knowledge is power. By understanding monkeypox and taking appropriate precautions, we can navigate this public health challenge effectively.